took your letter here. George Gale. Mr. George Gale. Okay. Yeah. So 8 letters. The first of the series is Deepak Moily. All of you take your notes and make notes for yourself. There are 2 guests. One is Namrata and one is Fazal. Okay. Welcome to the platform. Follow everything silently. Yeah. Mute all. Yes. Now, this is different. Write a letter to the emergency registrar of this admission doctor. So not this case notes. So then this is the case notes. The second one. The admission doctor. It is not admission doctor. It is admitting doctor. Admitting doctor. Admitting, not admission. Okay. It is admitting doctor. Okay. Admitting doctor. And next one is 1 second. It's going live already. So there we are. Yeah. Admitting doctor, Spirit Hospital, emergency department. Actually, you have done a mistake here. Okay. So what you had to do is something different. First one is admitting doctor, then emergency department, then Spirit Hospital. This is how you had to write. So you've done so many mistakes here. Admitting officer, admitting doctor, emergency department, Spirit Hospital. 3 lines. Okay. Then that's it. Yeah. Right. So this is messed up. Okay, 2 lines. Both the lines are messed up. Next, 10 July 2019. 10 July 2019. Yeah. This is 2015. This letter, 10 July 2009. Oh, which case notes you have taken? Something different about 2019. Okay. Okay, no problem. 10 July 2009. Dear Mr. Doctor. Why Mr.? Dear Doctor, that is enough. Dear Doctor, regarding Mrs. Betty Olsen. Mrs. Betty Olsen. How come Mrs. Betty Olsen? She is widowed. So you say Miss Betty Olsen. Okay. Right, fine. Date of birth 29 January 1926. Mrs. Olsen. So widowed. Okay, no problem. Mrs. Olsen, who has a history of hypertension. Miss Olsen, who has a history of hypertension, revealing suggestive features of cardiac-related symptoms. Who has a history of hypertension. Is this, you are writing an urgent letter? You're writing an urgent letter, right? You're writing to the emergency department. Remember that. You're writing to emergency department. Yeah, I shared already in the Telegram channel. I'll share that. So let me share it now itself, otherwise. Yeah. So 2 case notes are there. Both I'm sending. Whichever you feel comfortable, you can take. Okay. Yeah, both the case notes are here. Okay. Um, yeah, this is an emergency letter. Emergency department, emergency register, ambulance. This many things are there. Okay. So, what is the crushing chest pain? Okay. Who is experiencing? Who is experiencing means now. That time only you are writing the letter. Emergency basis. Okay. So, who has hypertension? Revealing or suggestive features of cardiac related symptoms. Is this important? That's why you are calling an ambulance. Cardiac related symptoms, that is ordinary ones also may be there. Okay. Who is experiencing? Mrs. Olsen. The most important point is who is experiencing now. Who is experiencing crushing chest pain? Who is experiencing what? Who is experiencing what? Today's visit is important. Who is experiencing persistent crushing chest pain radiating down left arm. Okay. Who is experiencing persistent crushing chest pain? Who is experiencing persistent crushing chest pain, comma, that you are right. Okay. History of hypertension, revealing suggestive features of cardiac related. All these things are not that important. Miss Olsen, this emergency is experiencing persisting crushing chest pain, requires essential treatment facility as she is being transferred at present by ambulance. Requires immediate admission. Okay. So this is gone. Okay. So continuation is requires. Okay. Requires. Okay. Patient ambulance called, patient transferred. Requires what? Emergency admission to the hospital. Emergency admission. Emergency register, emergency department. Okay. Requires emergency admission. Requires emergency admission, immediate admission or emergency admission or urgent admission. Requires emergency admission and appropriate management following the transfer, following the transfer to your facility. Following the transfer to your facility. Yeah. So Mrs. Olsen, who is experiencing persistent crushing chest pain, requires emergency admission and appropriate management following the transfer to your facility. That you can write. Right. Transfer by ambulance now to your facility. Yeah. Yes. In May 2009, comma should be here. Comma need not be here. Comma here. In May 2009, she has taken vaccination against flu. This is not important. First, you have to write today's visit. Where is today's visit? Where is today's visit? Today, till here, from here. You have to start here. Okay. Today, so this will go into the next paragraph. If it is important. Today's is the main problem. Okay. So all this will go off. Not here. Okay, not here. So today. Following one, she complained about English. This is past. No need this one. This is not needed. Today, her general condition. Emergency admission. Emergency letter. Emergency letter. Today's visit comes first. Okay. Right. Today's visit should come first. Okay. In an urgent letter. Today's visit should come first in an urgent letter. Okay. So write a letter to ambulance called patient transfer to your facility. So emergency registrar, emergency department. You should understand that one. No? Okay, first paragraph you have to write this one. Okay, today's visit. Today's visit is here. 16.3.75. Yeah, here. No, 10.5. 10 a.m. 10.5. So from here onwards you have to write. So 10.5. All these things. Okay, these things should come in the first paragraph. Okay, body paragraph 1. These things. Today's visit. And other visits you can write afterwards. Okay. Then today her general condition was abnormal. Today her general condition was abnormal. How can you say was past tense? Was is past tense, right? Today her general condition was abnormal. How can you say today her general condition? You say has been abnormal or is abnormal. Okay. Is abnormal. From morning means has been. Now means okay, has been abnormal. From morning means has been. Now means is. Today her general condition has been abnormal. And was experiencing fatigue. Has been abnormal. Very high. Okay. Very fatigue and high blood pressure. Also unable, ambulated physician was not available. The sentence is not set properly. Okay. Right. Yeah. Nausea, slight nausea, sleeplessness, shoulder and neck pain were experienced. You can say like that. Yeah. Fatigue and high blood pressure were noticed. So no need of worry. Fatigue and high blood pressure were noticed. Okay. Unable to ambulate. Unable to ambulate and physician. You messed up the sentence totally. Totally all different versions you have written here. Unable to ambulate and physician was not available. Ambulation was not possible. Physician was not available. So separate these things. Right. Let us see here. Ambulation. Where is ambulation not possible? Where is it? Today's visit. So tired and feeling generally weak. This is 10.5 from here. Tired and feeling generally weak. General weakness. Confinement to bed. Okay. General weakness and confinement to bed. We can say general weakness and confinement to bed. General weakness and confinement to bed have been noticed. Have been notified. Yeah. Currently, she has a sweating, chest pain, Also blood pressure not reduced by medication. Currently she has sweating and chest pain. Full stop. Full stop. No need here. Else also. Blood pressure was not reduced. Medication could not reduce the blood pressure. Medication could not reduce the blood pressure, or blood pressure was not reduced by medication. Medication could not reduce the blood pressure. So miss also. Next you can write these things if it is important. This not here. Okay, you can write in the later part. In May 2009, she has taken vaccination against flu following a month. She complained about indigestion, insomnia, chest pain, shoulder pain, but consulted maintained by medication. This is not required. No? This information actually is very old one. May 2009. Now it is July. Urgent letter. Okay. Mr. Olsen is widowed. Mr. Olsen. Mr. Olsen or Miss Olsen? Where did Mr. Olsen come from? How? Where did Mr. Olsen? Mr. Olsen or Miss Olsen? Mrs. Olsen. Till now you said Mrs. Olsen. Mrs. Olsen. Mrs. Olsen is widowed and and resides in Golden Pond retirement villages. Her son lives. Where is lives? Why it is not clear? Separately. Where is R? Where is T? In Australia. Lives separately in Australia. What do you mean by separately in Australia? Lives in Australia, no? Lives separately in Australia. What does that mean? She is a known case of hypothyroidism since 2007, for which a tablet Oroxin. Yeah, Vinitha Peter Hunt. Okay. So, for which a tab Oroxin. After I correct your letters, if you have another letter, you can send it. And you can message me. Sir, correct this letter also, so I'll add in the sequence. She is a known case of hypothyroidism since 2000. So she has been. Since, when you use the word since, you have to use has been. Since means from that time till now. She has been a known case of hypothyroidism since 2007, for which tab Oroxin, I don't understand what, 0.1 mg morning, and tab, why incomplete letters you will be writing? Tab B is not very clear. Farvia, 150 mg for hypertension. Why H capital letter? Are missing. For the last 6 years. For which tab for the last 6 years. For which tab Oroxin and tab Corvia for hypertension for the last 6 years. What do you mean by that? Where is the verb? Where is the verb? The verb is missing there. The verb is missing there. For which she is on. For which the current medication include. For which she has been taking. For which she has been taking tablet Oroxin for the last 6 months. And also a history of glaucoma in 2004. She also has a history of. She also has. Okay. She also has a history of glaucoma since 2004. She was diagnosed in 2004, but she has a history, okay, of glaucoma. Enough, okay. In 2004, that means now there is no history. You need not write this one, or you can put in brackets. Eye drops, trematol, 0.5 thrice a day, and normisone. Where is R? 10 mg as prescribed. Where is the verb here? Eye drops, trematol twice a day, and normisone 10 mg were prescribed. Were prescribed. Based on the aforementioned circumstances, it would be highly appreciated if you could provide continued care. Continuing care. Continuing care from this point on. At present, your esteemed is care pivotal role. Your esteemed dash is care pivotal role. What is this? Your esteemed dash is care pivotal role. I don't understand what exactly it is. Your expertise is at present your esteemed. I don't understand what you wanted to say here. Is extremely commendable. At present, your emergency assessment and follow-up action plan. Okay. At present, your emergency assessment and follow-up action plan would be profoundly beneficial. Okay, full stop. Kindly review the medication and non-prescribed medication. Kindly review the medication and non-prescribed medication are attached here with. What is that? Okay. The list of medications are attached is attached here with. The list of medications is attached here with. The list of medications is attached here with. In addition, she requires continence pad. Continence pad, only one pad is enough. She requires continence pads, walking stick, a walking stick, and a walking stick. She requires continence pads and a walking stick. Probably. Why probably? Not surely. Monitor them cardiac parameters and assessment. Monitor the cardiac parameters and Monitor and assess. Monitor the cardiac parameters and assess the condition. Monitor the cardiac parameters and assess the condition. Okay. In case, comma, any additional information is deemed extremely relevant, comma, please do not hesitate to contact me. Right. Yours sincerely. Why you wrote yours sincerely? Name is not there, no? So it should be yours faithfully. Okay. Yours faithfully. Night Nurse, Golden Pond Retirement Village. Yeah. So Deepak Moily. Deepak Moily. Unmute. Yeah. Yes, I have corrected your letter. A lot of mistakes are there. So I have explained what are the mistakes and how to correct those mistakes I have given you. I hope
Yes,
this feedback is beneficial for you, and you have to
yes,
be very
thank you so much, sir.
First thing is your handwriting has to improve a lot. What is this? This is dancing letters. Okay. So very neatly you have to write. Yeah, share your experience. You have 1 minute maximum.
Sir, thank you for your valuable feedback, sir. I'll improve myself handwriting, sir. And I will just do grammatical mistake. I'll get improvement, sir. I will watching your class. It's very important and it's very beneficial for me.
Yeah. Right. So this is Grand Master class and I'm Peter Simon with you. We are correcting the letters of the students. These are our registered regular students and those who are watching on the YouTube or on Zoom. If you're interested for subscriptions, you can get back to me because we are in the last batch of the old year and getting into the new batch. This is the Christmas batch and we are going to recruit some students. Yesterday we have registered one nurse. Okay, so still 3 nurses and 3 doctors. Places are remaining. If you are interested, you can contact me and the number is 9877867360. Yeah. So yeah, that is the end of the session here. So the next letter is about